Osteoporosis, fracture and treatment. Osteoporosis is a disease of the bones. It happens when you lose too much bone, make too little bone, or both. As a result, your bones become weak and may break from a minor fall or, in serious cases, even from simple action, like stunning or bumping into furniture. Osteoporosis means porous bone. If you look at healthy bone under a microscope, you will see that parts of it look like a honeycomb. If you have osteoporosis, the holes and space in the honeycomb are much bigger than they are in healthy bone. This means your bones have lost density or mass, and the structure of your bone tissue has become abnormal. As your bones become less dense, they also become weaker and more likely to break. If you're age 50 or older and have broken a bone, talk to your doctor or other healthcare provider and ask if you should have a bone density test. Some people have spine fractures that lead to a curve in their upper back. The first suggestion of spinal fractures and one of the first symptoms of osteoporosis may be when you realize you are not as tall as you used to be. Other signs and symptoms are back pain and stopped posture. If you have lost more than 1.5 inches from your weight as a young adult, you may wish to speak with your doctor about testing for osteoporosis. The risk factors are getting older, being small and thin, having a family history of osteoporosis, taking certain medicine, being a white Asian woman, having osteopenia, which is low bone density. About 54 million Americans have osteoporosis and low bone mass, placing them an increased risk for osteoporosis. Studies suggest that approximately 1 in 2 women and up to 1 in 4 men aged 50 and older will break a bone due to osteoporosis. There are 4 types of treatment. Cast immobilization. A places of fiberglass cast is the most common type of fracture treatment because most broken bones can heal successfully once they have been repositioned, and cast has been applied to keep the broken ends in proper position with their help. Functional cast of brass. The cast of brass allows limits of control movements of nerve joints. This treatment is desirable for some but not all fractures. Traction. Traction is usually used to align a bone or bones by gentle, steady pulling action. And external fixation. In this type of operation, metal pins of screws and placed into the broken bone above and below the fracture. The pins of screws are connected to a metal bar outside the skin. The device is a stabilization frame that holds the bones in the proper position while they heal. Kyphoplasty is a minimally invasive surgery used to treat a spinal compression fracture. Spinal compression fractures occur primarily in spinal vertebrae that have been weakened by osteoporosis. Compression fractures typically occur in the thoracic direction of the spine, which includes T1 through T12 vertebra, but may also occur in the lumbar spine, or L1 through L5. The goals of kyphoplasty are to reduce pain from the fracture, stabilize the vertebra, and restore the vertebra back to its normal height. In the procedure, the patient lies face down on the operating table. The surgeon makes a small half-inch incision over the affected area. Using X-ray guidance, the surgeon inserts a narrow tube through the pedicle into one side of the fractured vertebra. In balloon kyphoplasty, a balloon tube is then inserted through the tube and into the fractured vertebra. Once inside the vertebra, the balloon tube is inflated to create an open cavity inside the bones and to restore height to collapsed vertebra. The surgeon then deflates and removes the balloon tube from the vertebra, leaving the new bone cavity behind. A basic compound called PMMA, a tip of bone cement, is injected into the cavity until it is full. The cement hards quickly, creating an internal case inside of the fractured vertebra. The process may be repeated on other sides of vertebra body to ensure uniformity and increase the chance of complete deformity correction. In other forms of kyphoplasty, other surgical approaches for cutting the cavity may be used, such as a net or balloon. The surgeon then closes the incision. The patient stays on the operating table while the cement hardens, which usually takes about 5 minutes. Most patients can go home the same day as procedure. Osteoporosis is a silent disease. You might not know you have if you until you break a bone. A bone mineral density test is the best way to check your bone health. To keep bones strong is a diet rich in calcium and vitamin D. Exercise and do not smoke. If needed, medicine can also help. That's all for today. Hope the video is of great help.